hyaluronic acid, which will give us an antihypertensive effect. Now, to achieve 1 gram, you again need to have at least 200 to 300 grams of either of these food sources. Apart from that, you have onion and garlic, which is very prevalent probably. We've been talking about garlic consumption for a very long time for management of hypertension, but what people forget is that garlic has a half-life of somewhere around 2 to 6 hours. Therefore, a person who has uncontrolled hypertension would require more frequent dosage of garlic if you are relying on garlic. And you have green tea. The only caution in green tea is that it acts like an ACE inhibitor. So when you are giving a hypertensive or advising a hypertensive to consume green tea, you have to be careful about the medication that the person consumes. Be it herbal medications, be it these functional foods. If there is a drug-nutrient reaction, we would not know what has caused it, and the blood pressure does not really land up being controlled there. There are a few other functional foods as well. These have not been established by research per se, but yes, some of them do help in blood pressure control. We do not know how much. So we do not have a dose effect established yet for a lot of food items. Again, when we talk about nutrition, we can't talk only about salt. We would land up talking about sugar as well. So fructose is known to increase sodium retention, decrease the amount of the nitric oxide that's produced, and increase the renin-angiotensin system, and thus lead to hypertension. So we need to, when we're taking a dietary history or when you're prescribing a diet, we have to be very careful and not just focus on salt. We need to talk about sugar as well. There have been a lot of controversy surrounding what is the kind of sugar a person needs to have. Should we shift from the regular sugar to a pink salt or Himalayan salt or Celtic salt? Again, the bottom line remains the amount of sodium that you need to consume is what has to be decided. Irrespective of what salt are you having. Yes, Himalayan salt, those would have some other micronutrients, but they do not have a protective effect to an extent that we can neglect the sodium intake. And hence, be careful about the amount of sodium should be the priority when we are deciding the salt. But yes, salt maybe contributes to the maximum taste buds that we have, so that satisfies the taste buds, and that's the reason that we land up adding salt. And as a South Asia region, we do add a lot of salt even on the table. So the table salt, added salt that we have is pretty high. To offset it, there are some natural substitutes that we can use while cooking. So you add ginger, you add onion, there are garlic flakes that you'll get. You can use infused oils and different herbs and spices. Our region, the Southeast Asia region, is very rich in these herbs and spices. This is something that we can easily achieve. We do have a palette for it as well. Apart from salt and sugar, we do talk about potassium as well, because increasing potassium will lead to vasodilation in the long run. We would be looking at cytosolic smooth muscle calcium levels improving, and in the bargain, we are looking at reduction of blood pressure levels. Even if we are looking at smaller reductions, I'm not saying that having a diet would get an uncontrolled hypertensive into a controlled or a normotensive at the end of the day. The latest that we've been seeing is that the moment the gut microbiota is disturbed, the chances of the blood pressure variability go up. So whenever we are looking at dyslipidemia, whenever you're looking at inflammation, one of the reasons could be the raised TMAO levels. We do see that a Western diet contributes more towards a dysbiotic microbiota as compared to either a DASH or a plant-based or a Mediterranean diet, which would promote a eubiotic microbiota and help in the production of SCAFA, which is short chain fatty acids, GABA, different vitamins, polyphenols, and indols. As a last, we see that ketone body supplementation was talked about recently, and we've seen that 75 to 100 grams of ketones may achieve a ketosis for a patient. It does lead to improvement in the end. The period of years is once you convince a person, once you reinstate with them that yes, you need an intervention with nutrition, once you need an intervention with reduction or with a change in lifestyles, this has to be done repeatedly. Because again, when a person has the blood pressure levels which are absolutely managed now, let's say they, with medication and diet and everything, they come back to a normative level, one of the first things that they land up doing is going early with the diet. So that's when they start that, alright, I can maybe once a week start having this. I rather talk about natural foods which would enhance the taste, and I do not talk about products that instead of this salt you go in for this salt. That's not something that has not been successful in whatever I have come across till now.
Thank you very much, Mansl, for